I wrote Medical Illness and Schizophrenia specifically to fulfill a need for many clinical psychiatrists who are seeing patients with severe mental illness and recognize the fact that they suffer from a lot of medical comorbidities, and then this information was really not covered in most textbooks on schizophrenia. So in that respect, it really was a unique volume in specifically addressing the medical complications not only of the disease itself, but also sometimes of the treatments that we use for schizophrenia. Nowadays, many people recognize that metabolic problems with antipsychotics are important, but what this book really opened people's eyes to was other medical illnesses that we see in people with schizophrenia. Problems with smoking, hepatitis C, HIV, and this book really also addresses a unique need to understand how to treat patients with unique circumstances, such as those who are pregnant or lactating, and now expanded information on the treatment of children and adolescents. The target audience for this volume really is anyone who deals with patients with severe mental illness. The title of the book says schizophrenia, but really it applies to any population who are commonly seen in a community mental health or even private setting, comprising individuals with severe mental illnesses, many of whom often have similar comorbidities and unfortunately very high mortality rates from natural causes. So the hope was in creating this volume that patients would benefit by having more educated providers who are sensitive to the needs of this population and who really understand the issues which confront people who treat mental illnesses, not only both psychiatrically but as well as the medical needs.